discuss about anti-diarrheal drug. What is diarrhea? First you know about what is diarrhea, then you use the drug for treatment of diarrhea. Diarrhea is characterized by frequent bowel movement with a thin stool and there sometimes watering. It is occurred due to the passage of excess water in feces. Causes of diarrhea: diet, sometimes that is undigested, that induce the diarrhea. Genetic disorder, lactase deficiency in a parents, that also come in the child. That is genetic disorder to induce the diarrhea in some people. Infection due to the bacterial, viral, fungus and some parasite that induce the diarrhea. Actually, these are produce the toxin. Toxin influence the bowel movement, ultimately induce the diarrhea. And drug induce and stress also induce the diarrhea. Okay. What causes of diarrhea? First, infection. Second is the food poisoning. Third is the medications, food intolerance, and the disease occurring in the bowels and procedure in the bowels. Next, the relevant pathology. Actually, how to develop diarrhea? What is the mechanism behind the inducing the diarrhea? Actually, first severe diarrhea induced by the rotavirus. Rotavirus inhibit the sodium potassium adipase and structural damage the mucous membrane of the intestine, causes the diarrhea by the reducing the absorption of the water. Okay, and that is the if mechanism induced the rotavirus and some other bacterial and fungal that bolus cells occur in the intestine that stimulate the cyclic AMP, cyclic GMP, and that inhibit the absorption of sodium chloride. That's why accumulation of sodium in water and also peptin cell also secrete the sodium and bicarbonate ion. So that it means the accumulation of sodium chloride and bicarbonate are more inside of the lumen of the intestine. For the higher concentration, the secretion of more water in the intestine. That's why bowel movement or peristaltis movement are enhances and that influence the induce the diarrhea. Okay, next. Type of diarrhea, the acute type, once a sudden action, one or two type diarrhea, two times occurring in diarrhea during the traveling and during the undigested food. But chronic diarrhea, 2 week and long time induced due to the stress, irritation, bowel movement, rotavirus infections, bacterial infections, it may be occur. The antidiarrheal drug controls the relief of diarrhea and also their symptoms like pain, cramp in the inside of the stomach. Next, the goal of treatment: control the loss of fluid. It is must control the loss of fluid because in diarrhea excess of water or fluid are removed out from the body. It means maybe occur dehydration of the patient. A patient may be died. The first attempt to reduce the loss of the fluid, okay, and control the loss of the fluid, and you can also say that give the ORS goal for maintaining the fluid inside of the body of the patient. Identify the causes of disease. अब इसमें हमको आइडेंटिफाई करना कि what is the actual cause of diarrhea. Maybe bacterial, maybe rotavirus, maybe fungal, maybe parasite, maybe toxin induced. That's first identify the what is the reason inducing the diarrhea, then provide the symptomatic treatment and the peristalsis movement and stool containing the blood and severe cramp that treated by the helping of the drug. Next, the locally acting drug, adsorbent. Some drug are adsorbent that absorb the toxin, like just kaolin combined with the pectin is a good प्रिपरेशन ऑफ पाउडर डोजेस फॉर्म. ये पाउडर डोजेस फॉर्म होता है. ये क्या करता है? एडहेयर द बैक्टीरियल टॉक्सिन, बाइंड द वाटर एंड डिक्रीज द म्यूकस सिक्रीशन. तो इससे जो बैक्टीरियल टॉक्सिन होता है वो इस पे एडहेयर हो जाता है, चिपक जाता है, जिससे वाटर भी इस पे बाइंड हो जाता है, जिसकी वजह से जो है पेरिस्टाल्टिस मूवमेंट पे इन्फ्लुएंस ज़्यादा नहीं पड़ता है, तो डायरिया ठीक हो जाता है. नेक्स्ट, इसी तरह नेक्स्ट ड्रग्स है bismuth salicylate. That drug adhere bacteria or toxin, decrease the secretion of the fluid in the intestine, and inhibit the activity of bacteria. So that also the good for the treatment of diarrhea. And next, the centrally acting drug codeine. Codeine is generally not used for treatment of the diarrhea. Actually, this it having the side effect in constipation, then also reduce the diarrhea. But it is the lead to tolerance, addiction, and withdrawal manifestation. That's why that drug not used for treatment of diarrhea. Next. Diphenhydramine is the drug that lack addictive property and used for combination of atropine. Actually the anticholinergic drug that reduce the secretion of water. Reduce the secretion. That's why that can be used for treatment of diarrhea. Loperamine is a good drug that is the produce rapid and sustainably inhibit the peristaltis movement. If they inhibit the peristaltis movement, it means there is reduce the diarrhea by the more time and absorb of the fluid and water back to the inside of the body. Next, that oxytocides are the drug that synthesize analogous as the somatostatin and the highly effective in diarrhea of arsinoid syndrome. It's given by the SC subcutaneous IV routes and but its major side effects like constipation, low back pain, headache, and distant mouth dryness, dizziness, and the abdominal pain. Next, प्रिवेंशन इज बेटर देन क्योर. यदि डायरिया को ठीक करने से हमको पहले प्रिवेंट करना है, प्रिवेंशन कैसे करेंगे? गुड प्रैक्टिस, वॉश योर हैंड प्रॉपरली आफ्टर यूजिंग ऑफ द जो बाथरूम ईटिंग फूड एंड द regularly use sanitizer, vaccine given by rotavirus prevention that is a major severe causes of diarrhea, and food storage properly maintain the hygiene during the traveling. Thank you.